What do we want? Now! What do we want? Healthcare! When do we want it? Now! What do we want? Healthcare! When do we want it? Now! Right! Actually, we said, when do we want it? 1965. With back pay? With back pay. Thank you all so much for being out here. It's cold, but you believe, I think. Believe. So thanks for being out here. We got a bunch of folks who are going to be sharing healthcare stories. We got some people who want to share some things with us. You know, we've been talking here. There's a lot of folks who thought, well, we elected Barack Obama. How come everything didn't get fixed right away? How come everything's not all better? And it's you know, it's great to have folks out here who know. You know, we started something. What Obama said right off was, you know, electing me is just the first thing. Then the work starts. So it's great to see you. I'm seeing heads nodding from folks who know about this. So I'm glad you're all. I appreciate you all for being out here. I'm glad we're all out here to keep doing the work that's gonna change things. Because what we've got in healthcare right now does not work, and it cannot stand. And we're here to say, change it now. Healthcare now. So, I want to bring up our first person to share a healthcare story. It's someone I think many of you know. She did more to get Barack Obama elected president from the state of in terms of people here from the state of Washington of anybody. Debbie Patton, please come up.
Well, some of you may have heard me speak on this topic at Brian Barrett's town hall meeting right over here at the Washington Center last August. So if you've already heard this story, just keep it in mind, because I'm really, I think, a rarity in America today, which is most unfortunate. I had breast cancer in 2001. I had a bad diagnosis, and I had a lot of fear that I wasn't going to make it based on the pathology and so on. But I have still excellent healthcare coverage through my husband, who's a longshoreman. And it would be one of those plans that they so disparagingly call a Cadillac plan. But they paid all my bills. And in 2001 and 2002 dollars, all my treatments came to over $400,000. And I'd hate to think what it would cost now with the costs in healthcare increases every month, every year. And I had a couple of good friends who died of breast cancer because they had insurance, but once they had a diagnosis, then they were dropped, and no one else would pick them back up. And so when they had recurrences, they died. And I just don't think that's right, that someone the same age as me, with kids the same age as mine, have to die here in Washington State, right here in this town, because their medical carrier drops them. And so far, all of my follow-up treatments, or not treatments, appointments, have shown that I'm cancer-free at this time. But as we all know, that could change at any time. And what I worry about now is with the attack on labor and so many retirees losing their pension, their pensions or their medical benefits as retirees. If that were to happen to my husband, nobody would insure me. And so if I had a recurrence, I mean, we'd sell everything we owned and then I'd die, probably. And that's just not right. And I'm also really worried because I'm not the first person in my family that's had breast cancer. My mother had breast cancer twice, and my grandmother had breast cancer. And My daughter is 20 in college. She's under her dad's plan, but I'm just worried what's going to happen to her if a future employer or insurance carrier finds out that she's potentially a fourth-generation breast cancer victim. Will they cover her? And you know, what's going to happen to her? What's going to happen to my nieces when their prospective employers find out that we have this history in our family? And I just don't want that to happen to my daughter. I don't want it to happen to me, and I don't want it to happen to any of you. So we need to make sure that this bill, whatever passes, does away with the pre-existing condition and doesn't drop people for genetic traits that they have no control over. And it's just an outrage. So thank you for your support.